Well, hello and welcome to Rajat TV. You're watching India Fights Back with the host Rajat Kain. In this episode of the show, we'll discuss the importance of rural healthcare and its role in the pandemic control. Well, we saw how during the second wave, there were several states in which the rural belt suffered a lot in terms of catastrophe, in terms of healthcare and the response. So now, as we look forward to dealing with the pandemic and of course working on the hypothesis of a possible third wave, how we are placed in terms of rural healthcare. Well, for more on this, we are joined with a panel of two guests, Dr. Arunesh Kumar. He is Head of Department, Paras Chest Institute and Senior Pulmonologist. Many thanks, Dr. Kumar, for joining us. And Dr. E. Venkata Rao, he is member of Odisha State Advisory Committee for COVID-19. Many thanks, Dr. E. Venkata Rao, for joining us. Well, let me start with you, Dr. Arunesh Kumar. Sir, in terms of the larger question of a hypothesis of third wave, we all are looking forward at it. How we are placed in terms of infrastructure, medical infrastructure in rural India?
Well, we always be looking at the enormity of the Indian population, and there will always be we'll always be lagging behind. We will never come to a point where we'll say that we are fully prepared. Only last second wave has been devastating in terms of numbers, where even forget rural India, even the urban India struggled. In Delhi NCR, we had a first-hand experience how lack of oxygen, beds, hospital beds, was there. People were suffering. Medical care, doctors, nurses, they were stretched to the hilt. Somehow we came out of that wave. So far, we are there. Now, if you talk about the rural India, this, it has never been the perfect healthcare as if you wanted for the COVID. We have this learning from the from the second wave, that what this virus can do, and certain bits have been done by both state governments and the central government. Most important thing was the oxygen scarcity during the middle of the pandemic, and I think we will be better off if unfortunately we come to the third pandemic. Regarding awareness, regarding testing has been a major issue in the second wave. I think government's initiative of doing more and more testing, tracking, treating, and containing. Right. These things have been our learning from the second wave, which I'm sure will go a long way if the third wave were to come. But I think lots more has to be done, and I think if God forbid we come across the third wave, we should at least be better placed as compared to what we were in the second wave.
Right. Certainly. So we have to be better prepared in terms of our health infrastructure, and that starts from the basic testing of disease to finally addressing patient care. Of course, we are also dealing with a larger question of oxygen supply, of drugs and other critical care equipments. Well, Dr. E. Venkata Rao, sir, how a situation placed in rural belt of your state, sir?
Thank you, Rajat, for inviting me.
Many thanks, sir.
I would really put it as this is something like a hide and seek game. The first wave, when it came, the virus was trying to attack, and our people went hibernating. So the people who could not hibernate, like the socially downtrodden people, they suffered the maximum during the first wave. And then when the unlocking was done, they started coming out of their hibernating places, and the second wave started occurring. So this is nothing but a hide and seek game. As and when it is likely to, we are trying to come in front of the virus, we are likely to suffer. Now, this impending third wave has been speculated, mostly an epidemiological model, but that epidemiological model is primarily based on the behavior, human behavior.
Right.
Now, again the unlocking process is started and the number of cases have started going up. Now, the other day, we were trying to compare Odisha with Delhi. Now, Delhi had a worst pandemic in the second wave, but now the Delhi is not having enough cases. Now, Odisha is still continuing to have good number of cases. At the same time, huge number of deaths. If you look at the Odisha figure, the number of deaths are increasing. So the point remains is very clear that as and when there is a relaxation of the lockdown, we will be suffering from this kind of problems. For that reason, government of Odisha has taken very specific action. Like when in the second wave, when the rural belt was affected, right from the beginning, and now it is continuing also, the immunization. Vaccination is in a very good pace, and Ashas and Anganwadis have been trained to go for a door-to-door step vaccination. So that would definitely give probably will give a good protection, unless in the third wave we have some dangerous kind of some abnormal variant if it starts coming up.
Right.
But nevertheless, we are pretty hopeful.
Dr. Rao, just stay on this very important point, as you mentioned about the vaccine and, of course, like role of social, you can say the local bodies here in helping out people, and, of course, like transmission of message. That is extremely essential here. Well, I'll come back to you on this important point. Dr. Kumar, are we still seeing some sort of hesitation for vaccine per se in rural areas? And how, if it is, then how worrisome it is?
I must say that in my experience, although I must say, I'm talking about the urban area, but overall, what we are hearing from the colleagues around, that vaccine hesitancy has gone down, which is a very good thing. And part of it is when the vaccine came in, people had many questions, because every day on social medias, newspaper, television, you get one vaccine adverse event, and that is being, people will listen to that first. And they won't listen to how vaccine is reducing the mortality, how vaccine is reducing the number of people being hospitalized. Those sort of things go down. But the one reaction, which is in medical science, we always say, even paracetamol can give you. There's no drug made in medical pharmacopoeia, which doesn't have any side effect. I wish there was one. And there is no ideal vaccine either. We don't know about any ideal vaccine so far being made. So this is not an exception. So that was there before, but I'm glad to say that particularly in area, the patients we come across, that hesitancy is definitely going down and people are coming out in a large number. Still in some pockets in the rural India, there will be a problem. It's because these information, the full information about the vaccine, how useful it is, how innocuous it is, how less side effect it is carrying, may not have been completely percolated as compared to the urban part.
Okay.
So that work has been done and it's an ongoing process, but I'm sure the hesitancy all over the India is going down.
Certainly, hesitation in terms of vaccination is coming down, as Dr. Arunesh Kumar puts it. Dr. Rao, among the challenges of healthcare in rural belt, why I'm emphasizing, because this particular episode is strictly on how well placed we are if we talk of the rural areas of India vis-a-vis the waves, or to say spike in numbers, a hypothesis on spike in numbers for COVID-19. So my question here is, sir, the challenges in terms of communication to people or patron in the rural areas.
Yeah, definitely this will be very challenging. So it's such a huge pandemic. We had never expected that India would be in a position to handle it. The first lockdown, if you look at that was primarily not to contain the virus. Of course, it was contained virus, but our preparedness. But the second wave gave us the learnings that we need to be prepared. And for the third wave, definitely our rural areas are better prepared. But the biggest thing, what Arunesh just now mentioned, is about how to handle the vaccine hesitancy. See, the vaccine hesitancy is something like, it's a herd phenomenon. Like if one single person in the herd thinks that yes, it is dangerous, then the word of mouth that travel so fast, and the people would definitely go, I mean, they go bonkers. They would definitely would never like to come forward to take the vaccination. But this is the biggest challenge what we will be facing in while handling the rural community, because urban community we have a better access to information, and we have a better equipment, knowledge, know-how, everything, education, everything is there. But in the rural community, there is a traditional beliefs. Okay, I mean, I would like to quote here one particular community in Bodh district. Like few of the students, their children, they are coming here as a residential teaching. They are there for their schooling and college, and in their villages, there's discussion is going on that if at all we have to suffer, why not we suffer from corona? Why to suffer from side effects of the corona vaccine?
Okay.
This is very unfortunate. Now, the people, they do not understand that how the corona is likely to affect and how the health functionaries are helpless. We don't have, because the biggest problem in corona, what happens? There is an initial short spike, 3 to 5 days maximum, and sometimes 1 or 2 days only, mild fever, and it disappears. And the second wave, after about 5 to 6 days, within a single, I mean, span, after 5 to 6 days gap, again, there is persistent cough or fever and everything. And then the patient lands up in the hospital. That interim period, we need to focus in this junction that if at all we have to train the rural fraternity, rural community, saying that, okay, in case you have a fever, unless and otherwise proven, it is corona. And in the initial 2 to 3 days, even if RT-PCR negative, don't ignore it. And subsequently, it is going to come back. And the sooner you report to the hospital, the better is the chances of survival. So these 2 points, one is to overcome the vaccine hesitancy, and number 2 is to report to the hospital at the earliest when the second spell of the corona, it's from the upper respiratory, when it migrates to the lower respiratory tract infection. Before that, we should be able to reach the healthcare facility.
Right, absolutely. So these are essential information, or to say suggestions, given by our experts. Dear viewers, you're watching this program, please listen to experts. Do not listen to any hearsay or misinformation. There we have these 2 experts, Dr. Arunesh Kumar and Dr. E. Venkata Rao, representing the field, representing their own experiences of how they have dealt with the patients and those who have suffered during COVID-19, last 1.5 years with COVID-19. Dr. Arunesh Kumar, sir, now if we talk of the urban belt per se, and the habits, and of late what we have seen is there are a lot of places where there is a slip in terms of COVID appropriate behavior. How worrisome that trend is?
It's very worrisome, and I think we have been talking about on various platforms that forget about, people are more talking about these days about the mutation, the lab thing. These are all laboratory thing. Who knows? Even I as a clinician, having seen so many hundreds of cases of COVID, I don't know which one of mine was lambda, which one was beta, which was alpha. And what people are talking about these days are mutations, but not talking about something which is in front of you. That whatever mutation virus mutates to, whatever changes they end up as, they will always be transmitted by droplet infection. That's not going to change. They're not going to fly. They're not going to, the mode of transmission is not going to change. We also know that symptoms will be more or less same. We also know that that some virus can be more transmissible. I take that. But if we observe to a COVID appropriate behavior, put a mask on, keep a social distancing, you are not going to catch this infection. So there has been what I call a complacency in the population, urban population. If you go to a tourist spot, recently we have been seeing the videos of people roaming around in the valleys with a mask on in large numbers. So this is very worrisome, and perhaps that will be a harbinger of the third wave which we are talking about. Because remember, Second wave's extension is still ongoing. So our state, Northeast, Maharashtra, Kerala are still seeing the number of cases. They have not gone down. We have unlocked. Practically, population mobility has nearly turned back to normal. These viruses are going to travel because they travel with an infected person, and they're going to come and create a new wave. So people have to understand, they all know. I mean, I will be very surprised if somebody in India now will not know what is mask.
Right.
So I think,
Absolutely.
courtesy you guys, I must congratulate to social media, to the television, to the newspaper, that one thing I know for sure, that majority of us know that how we can prevent contracting the virus. But if we don't heed to that advice, that comes to you as a person. I don't think it's a government's job to penalize somebody for not wearing a mask, although we are saying that they should do it. But this is very disheartening. Looking at how stretched the Medicare has been, doctors, nurses, how they go under this, because this poses a problem to everyone. So I think I appeal through your show to the people who are listening that please heed to the COVID appropriate behavior. Wear mask. This disease is, you cannot have this virus in if you put a mask on. So take it that way, regardless of what mutation it happens. Forget mutation. Let's not talk about mutation at all.
Absolutely.
Just stick to basic things. So if you have got a symptom, you isolate yourself, seek medical opinion, get yourself tested. And if you are COVID negative, watch out for your symptoms, but make sure that from you, the symptoms don't go to your household or to your neighbors. And the way you can do it by heeding to COVID appropriate behavior. And that's the basic of it.
Well, certainly. Dr. Rao, shifting back to the rural belt, there have been a lot of digital platforms, as we have seen, portals as introduced by the government. So we are seeing both center and state, they're trying as much as possible in terms of using technologies so as to have a better understanding, or at least get a better feedback of how are things placed. So how has these apps, portals, helped the medical fraternity in their operations?
So this will be pretty challenging to answer this question, because these apps, this network connectivity, all these things more or less are restricted to the urban areas.
Okay. But
The
e-grams Swaraj
percolation-
or something
Yeah,
which is
yeah,
dedicated
yeah,
only for,
Yeah, the percolation into the rural belt is, as on today, it is still a challenge. Now the point
Right.
is, as Arunesh just now mentioned, that in India, is there anyone who doesn't know what is a mask? Why should he putting on the mask? Now, for that information to percolate into the rural belt, we don't require a technology, and that technology is already available. Now, the technology which is required either for medical care or for the percolation of the vaccination intervention. That is, we are facing the challenge. Now, as Arunesh mentioned, that whether it is lambda or alpha or beta, it doesn't matter. The COVID appropriate behavior is more important. Now, for that, the rural belt happens, this complacency comes in. Now, that we need to check it. Like, I'll tell you, this morning, what happened? When I went to get some vegetable, and two vegetable vendors, they are putting on the mask as a chin guard.
Right.
Now, the mouth and the nose is quite open. I asked a simple question saying that, why are you wearing this? And the answer is that because we have to pay the penalty if we do not wear it. So the point remains is very clear, even if at all our government is introducing, because when it goes out of the control, government has to implement certain strict measures and penalty should be there. And in such a case, any appropriate behavior, if there is a deviation, which should be penalized. Like putting on the mask over the chin, yes, the police officer should take a snap with a smartphone and then charge it. That should be the answer.
It's really worrisome. Wearing a mask is not that difficult. So this is a collective appeal from all of us. Like, please, viewers, keep wearing a mask. Like whenever you step out of home, or even at home sometimes, if you're receiving something. So keep wearing a mask, and it's not really difficult to wear the mask. You just have to cover your face and nose. It's not a chin guard, as Dr. Venkata just
I'll
mentioned.
just add one more thing.
Please, sir, go
I'll
ahead,
just
sir.
add one more thing. Now the point is, many people they complain, saying that okay, this mask is giving a, I mean, it's a what they local colloquial language is an asphyxiated feeling.
Oh, okay, suffocation ho raha hai. Right.
Suffocation.
Yeah.
Suffocation. Now I explain them. From morning 9 o'clock till evening 5 o'clock with a N95 mask and a cloth mask, because I use a double mask. Cloth mask is again 5 layered, N95 is 6 layered, and it does not cause the amount of oxygen what is required is only you have a problem when you go exert yourself. If you're gently sitting and modest work you're doing, it will not cause any breathlessness. This is the important message. Everyone should get it, and it is doable.
Certainly. So these are, as is emphasized, that these are small little things that all of us needs to do so as to keep this pandemic at bay. Dr. Arunesh Kumar, so I mean, your take on how or rather has these digital or digitization for getting data and feedback on COVID-19 patients and beneficiaries, benefactors, has it helped the medical fraternity?
To an extent, yes. For statistical purposes, they do, because you get to know what are the numbers, how many people are vaccinated. Now, Arogya Setu has been touted as one of the government apps which shows the numbers. You know that who in your vicinity is unwell with the COVID. So that way it is there. Now, for testing, those who are tested, there is a record that how many who has been COVID tested. But apart from that, I have not come across much in terms of technology, like in the patient management as such. Now, when there was in the second wave just gone, which is ongoing, in fact, there was a scarcity of medications. So at that time, government authorities had made some, a group where we could request that drug for our patients because it was not freely available. That time it was of help because we were able to tell them how many patients who need that particular, say for instance, tocilizumab and all, which went into the government control. So we knew the status, that how many vials they have got, how many we can give. So technology is always of help. We shouldn't say that, but I think it was a part of it. It didn't particularly sort of sorted all the problems.
Right.
But yes, I would say it was helpful. Yes.
Right. Dr. Rao, as we are about to close the show, sir, just one last question to you in terms of, since you represent a state or you're working in the state whereby we have a very sizable number of rural population, I think nearly 80%, if I'm not wrong.
Yes.
Yes. In terms of economies, how is the rural belt managing the COVID care?
See, the economy is definitely going to be hampered across the country, irrespective of whether it is urban or rural. But one thing is for sure, that this is my, it's not my speculation or my prediction or whatever you call it, is that the rural belt economy is not likely to be affected much because the livelihood is most likely affected in the urban areas. But in the rural areas where they produce their own and they sell their own, the export and the things which have to be sent beyond your reach, that has been hampered to some extent.
Right.
But the issue is somewhere we have to redefine ourselves, that we have to manage with our economy, because jaan hai to jahan hai. So unless we take care of our health first, then our livelihood and our future we should not be, that has to come as a secondary, because this is not any ordinary situation. This is like a wartime situation.
Right.
Until the pandemic is over, we have to take care of ourselves, and irrespective of the economy, if it is affected, we have to, manage with the existing problems, resources.
Certainly. So managing with the existing resources. At the same time, so just one last question. how well placed or our primary health centers and rural health centers are to absorb or to at least take a pressure of a pandemic of this scale?
Yeah, definitely. This is good only, I would say, because the primary health centers and all, see, the out of 100 cases of COVID, more than 85 are mild or asymptomatic. Now, for them, what we require is the supportive care, and the primary health centers are equipped enough. And we are rolling out the primary care, what has to be rolled out for this COVID. And the remaining, that is the biggest challenge, is the severe cases and the hospitalization cases. Now, over there, primary health care centers or the first referral units like block hospitals and all, they are definitely in a compromised position. Because India had never thought of in that direction at all. That okay, how many? Like in 1946, Boer Committee had recommended some recommendations for the health infrastructure to be made in India in a way. But over 70 years, we could not do that. Probably we are doing it. So had it been done, then we would have been in still a better position, but currently we are in a challenging position.
Right. Well, Dr. Arunesh Kumar, I just have a minute here. So how difficult this has been time for everybody in terms of, getting access to affordable healthcare? This is concerning both rural and urban belt.
It has been, I mean, regardless of where you lived, second wave, I think we have seen, I'm sure Dr. Rao will agree with me that in our lifetimes, we have never come across a tragedy of this sort. I mean, this was like a one in the lifetime. That's why I said I very much hope that we don't have to see it again. So regardless of where you were, I mean, urban, it was no different to rural. There were no oxygen, there were no beds, people were ill, people were, get hold of oxygen anywhere they could get a hand on. And, lack of medications, essential medications, there were scarcity. So we were very badly placed. We perhaps were not prepared, and it took us by surprise because we thought that we had won the war, but it was still. And that's why I again appeal that, although in the area where I am sitting at the moment, we are very cool and calm. I'm not seeing any COVID patients for the last 1 month, as I was just speaking to Dr. Rao. But that doesn't mean that this may be a lull before the storm. If the way people are behaving, the way transmission happens, God forbid, God knows if the mutant variety is there, if it is highly transmissible, they are going to get new people infected, and we may come across the same thing again. So I think two important things which we talked about is vaccination, ramping up the vaccination, reducing vaccine hesitancy, and wearing the mask. I think these are the three important things we need to do, and that is our way out. There is no other way out, unfortunately.
Absolutely. I guess all of us agree with you, Dr. Arunesh Kumar. I mean, this is the way out. Vaccination, whosoever is eligible should get the vaccination, and of course, maintaining COVID-appropriate behavior. Many thanks, Dr. Kumar from Paras Hospital, Gurugram, for joining us. Many thanks, Dr. E. Venkata Rao, member, Odisha Advisory Committee on COVID-19. Well, that's it in this edition of IFB. Thank you. Goodbye.